this is Dr. Wells with Wells Medicine. So a lot of patients will ask me how ketamine fits into all of these online advice on how to feel better and all of the therapies that we ask patients to try some of the techniques from. And the analogy that I use is that if you've broken a leg, sort of as the analogy for depression or anxiety, if you've broken your leg, ketamine is kind of like the cast. So it can help to allow you to fix your broken leg, and it can help with the broken leg in a way that just medications can't help with, and in a way that resting and changing your perspective can't help with. But once that cast comes off, there's still a lot of work to be done for healing your leg with physical therapy. And the physical therapy in this analogy is the coping strategies and the lifestyle changes and the starting to exercise. And when you have something like a broken leg, you need both the cast and the physical therapy, the work at home, kind of combining them in a holistic whole to have the best results. So if you just had the cast and you didn't do any of the physical therapy work, you wouldn't have the strength, you wouldn't have the flexibility that you had before you broke your leg. If you just had the physical therapy, your bones wouldn't have a chance to heal without having that cast there. In another analogy, as an anesthesiologist, I do a lot of anesthesia for bariatric surgery. And so if you're talking about an illness like obesity, the bariatric surgery literally reroutes their whole stomach and intestines to cause it to be almost impossible for them to have absorption and intake of the same number of calories. So for those patients, the obesity in this analogy is the depression and the anxiety, and the bariatric surgery is the ketamine. And so the ketamine for 70 to 80% of patients really reduces symptoms by up to 50% by the second or third infusion for depression and anxiety. So just like the stomach surgery, it makes it almost impossible for them to be depressed in this analogy. But if you've been in bariatric surgery populations long enough, you've met people who figured out a way to eat chocolate chips or candy bars or milkshakes and kind of override the changes that the bariatric surgery makes. So not only do you have to have the bariatric surgery, the ketamine in this case, but you also have to make changes in order to sustain the incredible rerouting of your intestine to keep the weight off. So in bariatric surgery's case, it's changing your diet, it's starting to exercise, and it's not adopting some really kind of liquid calorie diets. So I think both of those are really great analogies to the way ketamine kind of supports and creates the environment in which those changes are not only possible, but in which those changes are likely. And those changes then kind of support the benefits of the ketamine to provide stability and resilience to the mood changes that the ketamine creates.